Hello everybody, and welcome to the Thursday edition of Video Clips. And I picked a couple of topics that I want to cover in a little bit of depth. And the first one is consequences of sleep deprivation. Sleep deprivation is so common that it's become the new norm, and there are a whole lot of reasons for it, which include diet, health status, anxiety, depression, lack of exercise, and in many cases a deliberate decision to sleep less in order to accomplish more. I made that decision at various points in time in my own life. But humans, and in fact all mammals, do need sleep, and the consequences of sleep deprivation can be quite serious and include things like stress, depression, cognitive impairment, and a higher risk of conditions like hypertension, obesity, and metabolic syndrome. What's even more important is that the level of sleep deprivation that is required to cause adverse health effects is much lower than we previously thought. According to University of Chicago sleep researcher Eva von Cotter, all systems of the body are affected even by very minimal sleep deprivation. Sleep deprivation, for example, has a profound effect on the brain. Electroencephalograms have confirmed changes in normal brain activity, which explains why sleep deprivation has been shown to negatively alter things like reaction time and mood and judgment and memory. When sleep deprived, the basal forebrain shows increased levels of adenosine, a nucleoside that can affect function. Animal studies have shown that sleep deprivation results in increased adenosine levels, but that those levels drop to normal as soon as the animals are allowed to sleep normally again. Pharmaceutically altering adenosine levels in rats resulted in symptoms of impairment similar to the impairments noted in animals and humans who are sleep deprived. By the way, if you've ever wondered why drinking caffeinated beverages keeps people up, some people anyway, it's because it blocks adenosine receptors and therefore allows people to stay awake. The negative effects of not sleeping are not limited to the brain. There can be decreases in strength and weight gain, and that weight gained as a result of not sleeping is lost quickly when people are allowed to sleep again. So it's clearly associated with the sleep issue. The weight's gained when people don't sleep, weight is lost when people start sleeping again. According to University of Pennsylvania sleep researcher David Dingus, epidemiological studies show that people who sleep less than 6 hours a night are almost always overweight or obese. They also have increased risk as a result of sleep and the weight of developing diabetes or having a heart attack. Now, there are a whole lot of mechanisms of action, but one really simple one is just overeating. Many studies have shown that people who don't get enough sleep eat an average of 300 extra calories a day. And one study that I covered last year on this issue showed that people who are sleep deprived not only eat more calories, but they tend to choose the worst possible options in their sleep deprived state, and then their decision making returns to normal and better as soon as they get some sleep. Now, most people assume that the negative effects of sleep deprivation are temporary and they go away when they're finally able to get enough sleep. But animal studies have shown that this is not always the case, and the effects can linger long after the animals have caught up on sleep. The amount of time required for full recovery is unknown, but there are some studies right now that are looking at this and trying to figure out if there is some marker that we can count on that says if you go back to sleeping normally for this much time, you can recover what you lost. Dingus has conducted several sleep restriction studies on humans which have shown that there is a lot of variability in terms of the effects of sleep deprivation on his subjects. Some clearly deteriorate faster than others, and some have virtually no response. Repeated experiments using the same subjects showed the same results. So people who were vulnerable to the negative effects of sleep restriction, in follow-up studies the same thing happened, and then people who seemed somewhat immune to the effects, that was the way they responded every time too. So Dingus labeled his subjects according to how they responded. Type 1 were resilient, basically unaffected. Type 2, intermediate, some effect but not really much. And type 3, vulnerable. Now, most sleep researchers claim not to know the cause of this variability, but some sleep experts also say that there are people who are just short sleepers. And a great book about sleep, I think it's a great book anyway, it's called No More Sleepless Nights. In it, authors Peter Hari and Shirley Lindy say that good night's sleep can range from less than 3 hours to over 10 hours, and that normal is different for various people. 20% of people sleep less than 6 hours a night. They're called short sleepers. This is normal for them, and attempts to get them to sleep longer backfires, because what happens is they end up sleeping the same amount of time but spreading the sleep over a longer number of hours, and then this causes the quality of sleep to go down. They don't get as much deep sleep. Hari and Lindy suggest that many, if most people, can determine if they're short sleepers or long sleepers on their own. I guess one of the reasons I like this book is it didn't seem to be so inclined to send everybody to the sleep lab and to experts to figure this stuff out. I think it included a lot of tools on how people can figure out their own sleep patterns. But what they were basically saying is that once you identify the pattern that works for you, even if you're a short sleeper, that doesn't mean that you have a problem. On the other hand, people who really are affected by sleep deprivation should adjust their schedules as soon as possible, because the consequences of sleep deprivation for them can be serious. They may not be entirely reversible, and we really don't know how much time it takes to reverse all the damage, or if it even can be done. So anyway, just some perspective on sleep. We talk about that at the office because we're all so busy. Everybody here pulls some late nights and that sort of thing, and we've become more conscious, I think, of trying to take care of ourselves here better in that area. And I think at this age, talking about how much sleep you don't get is not necessarily a great strategy for health promotion. All right, this next study has to do with stress and cancer, and I find it incredibly fascinating. The role of stress in cancer development and cancer promotion is not really well understood. And I think what we can agree on is that sustained negative stress adversely affects humans. At least we know it affects their quality of life. I mean, I can speak to that personally. I am not happy when I'm stressed for long periods of time. But I think we also have to remember that humans are designed for stress, and that historically we have faced a great deal of stress. The idea that it's more stressful to be alive today than it was when we were cave dwellers is kind of laughable when you think about we had to outrun animals chasing us, and just getting food and water every day it was a full-time job. So I don't know that we can necessarily say that modern living is so stressful. We complain about nothingness, like my satellite isn't working today, or my cell phone reception isn't good. So how much of that is really stress? Another thing is that some studies show that there is benefit to having stress. One that's really interesting is the study that showed that stress can reduce the risk of breast cancer because stressed women produce less estrogen. And so, so there's just a lot of considerations, but there is widespread agreement that chronic and unrelenting stress has a negative impact on the body. As it pertains to cancer, studies show more progression of cancer and lower survival rates for stressed cancer patients. A new mouse study explains, or attempts to explain, the mechanism by which stress might worsen outcomes for cancer patients by spreading cancer through the lymph system as a result of changes in the lymph vasculature. So how the researchers looked at this, they took mice that were bred to develop mammary tumors, and mice given tumor transplants to they subjected these mice to stress by confining them in small spaces, and some in normal spaces. So some were in cages that were very confined, some were in their normal cages. There was no difference between the two groups, those that were stressed by confinement and those that were in normal cages, in terms of the actual primary tumor growth, but where they did see changes were significant differences in lymph vasculature and the incidence of metastases. So the cancer became more deadly for the mice that were confined. According to researcher Erica Stone, stress results in the construction of new lymph vessels from the tumor, and also increases the speed at which cancer cells move out of the tumor and into those lymph vessels. Next, the researchers looked at whether or not metastases could be inhibited by blocking stress signaling pathways. They gave the mice beta blockers, which are normally used to treat hypertensive patients, but also for some unknown reason inhibit stress hormones like norepinephrine, which is suspected to be linked to the risk of cancer metastases. Mice given beta blockers had less change to the lymph vessels at the primary tumor site, and reduced metastases to the lymph nodes. On the other hand, stimulating norepinephrine receptors increased lymph vessel density and also increased metastases. This stimulation also resulted in increased recruitment of inflammatory cells like macrophages, and there's a great deal of evidence showing that inflammation is associated with increased tumor growth and cancer progression and metastases. In other words, I think we can safely conclude, because these aren't the only studies, there just happen to be some good ones to talk about because they illustrate the point, that stress affects people on a psychological basis, but it also affects them on a biological basis as well. Now, what made the study even more interesting and relevant is that it also included some data from almost 1,000 human breast cancer patients, and the data showed that patients taking beta blockers had lower incidence of both lymph node and distant metastases, even after controlling for things like age and treatment method. Now, to talk about cancer patients and stress, I think all cancer patients are stressed, and part of it is just the diagnosis. A lot of it is the difficulty in making choices about treatment. Oncologists often pressure patients to begin treatment right away without allowing them adequate time to evaluate and even making them think that their life hinges on starting treatment 2 days from now instead of 2 weeks or 2 months from now. And then well-meaning family and friends chime in, often pressuring the patients to do what their oncologist says, your doctor knows best. And then people start throwing out all kinds of options for alternative treatments and articles you should read. I remember that I read an article where one terminal cancer patient who survived was telling his story of survival. And he said he got so many suggestions from the people in his life who cared about him. He was unsure of what was going to kill him first, the cancer, or trying to wade through all of the well-meaning people and all the suggestions that they were positive were going to benefit him. So I think what this study basically shows us is that we should really include some specific strategies for stress reduction for cancer patients, and it starts with a wake-up call to friends and family to not contribute to the problem. I can tell you that talking with our members over the years, many of them have shared with me how much stress they have experienced as a result of well-meaning, but the road to hell is paved with good intentions. I just have to say that. All these well-meaning people chiming in and having something to say about it. I don't particularly think that the use of beta blockers is a good idea, even though it showed some efficacy here. And the two reasons are that, first of all, there are side effects from taking beta blockers, and the second thing is we don't even know what the mechanism of action is. And I think there are better ways that we can help cancer patients who are stressed. And those would include things like cognitive therapy and yoga, meditation, prayer, mindfulness training, massage, or almost anything else that a cancer patient would deem helpful for his or her own well-being. So anyhow, stress is, I love when people talk about eliminating stress. If you plan to show up and live in today's world, you're going to have some, and like I said, a lot of it we make probably too much of, but you can't eliminate stress. I think you can change the dynamic of things in your life. I think you can learn to respond to stress differently, and I think some awareness of this as it pertains to cancer patients would maybe make us all better friends and allies for cancer patients. I know since I read Dr. Turner's book, Radical Remission, I learned a lot about how to be more helpful to people, listen more, talk less, that sort of thing. So anyway, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.